Okay, we're going to go ahead and get started. This is Nancy for those of you online, and we've got a room full in here, so thank you for spending the next hour with us. Hopefully we'll make it as quickly as possible, but it is really important to make sure that we get you all signed up for your benefits. Everyone, even if you're not making a change, you do have to go in the system, and Kathy is here from Town Benefit and will be explaining all of our benefits, going through really just one change, and getting you all the information you need so you can go away and get signed up. I'm going to make a plug here before we get started with benefits because HR is just on a roll and we are implementing lots of things. How many of you have logged onto TrackStar already? The new performance. Awesome. Tuesday, no one raised their hand. How many of you started your self-assessment? Good, good. Okay. If you have any questions, you've got Carly, you've got Kim, you've got Catherine, you've got myself. Skype us, we'll run to your desk and make sure that you're logged in and that you understand what you're doing. Everything online is telling you the deadline for your self-assessment is May 31st, which is tomorrow. I know that was a very short kind of rollout. You and I both know whether it's 2 weeks, 2 days, or 2 hours, you'd wait till the last hour to do it. But having said that, we know that we kind of threw that on you last minute. Oh, Catherine's here too. I was thinking you were back in the office. So if you need to take a little bit more time, obviously take that time you need. Just communicate with your manager so that your manager knows, and they should be communicating with you the expectations. The more you go into June on doing your self-assessment, less time you're giving your manager to actually do your review. And you probably want to give them as much time as you can, especially if you're in development because that is such a huge group and I know that'll take a while. I think you will find the system very easy though. If you could block 30 minutes off on your calendar, it really should not take you more than that. You are not justifying your existence. You're just sharing your thoughts on where you feel you are in certain areas so that your manager understands what you think so that when they sit down, they can really gauge that conversation. Probably the most challenging part is entering your goals because that takes a little bit. And you should know what your goals are. We sat down last August and September. Every department presented to the leadership team and had department goals approved. And then from there, that should have rolled out in your department. But if you have questions, go to your manager. Just, make sure that you're agreeing. We will roll out in July, we'll start the new cycle and we'll do lots of training on setting new goals and you'll be able to set your goals for next year. So everyone will have them entered in the system and then we'll talk more about that later. But I did want to give a plug for the TrackStar and your performance management, make sure you're getting that going. So with all that said, I think we've given enough time and delayed enough so everyone is logged in online. And I will turn over to Kathy and have her go over the benefits for this year.
Great. Thank you, Nancy. Good morning, everyone. Can you hear me okay in the back? And welcome to those who are joining online. My name is Kathy Kramer, and I work with Town Benefits. And we are your benefits consultant. We work very closely with Nancy and your benefits team each year, taking a look at the global package of benefits that you're offered. And our role is to try to make sure we can help coordinate a comprehensive package and hopefully meet all your needs. So what we're doing today is we're going to go through some health reform news that we want to be sure you all know about every year. We will also spend probably the majority of our time talking about your current benefits that you're having offered and those that are new. We will then spend a bit of time talking about your health reimbursement arrangement, or HRA, because you have a generous contribution from Operation Smile towards an HRA. And then lastly, we will review what you need to do to make your benefit choices. Nancy mentioned to you that everyone does need to go in and make your choices so that we know what your annual elections will be. So starting with the health reform news. The Affordable Care Act, or ACA, some people call it Obamacare, does require that groups like Operation Smile, when they offer you a benefit package, that they offer you what they consider an affordable option. And what affordability in the ACA world is around income, which on this slide you'll see 6%. You all are offered at least one, if not more, benefit plans that is considered affordable under the ACA. This really just means that if you would want to go out to the exchange and buy a plan on your own, you certainly could do that. But because you have an affordable option, you would not be eligible for any kind of a subsidy, for that plan if you were to purchase it. The next bit of news around healthcare is with Medicare. Is anyone in the room here eligible for Medicare? Okay. Well, what this means is that you are still eligible to join your group plan, one of the benefit plans offered, and still be enrolled in Medicare. Medicare wants to be sure that you have a pharmacy benefit that is as good as or better than what Medicare would offer you. And that is the case with the pharmacy benefits that you have, which means you would not be penalized if you were to decide to join your group plan here at the same time. One of the last pieces of news through healthcare is to talk about the federal program CHIP, or the Children's Health Insurance Program. In Virginia, this is called FAMIS. In some of the other states where anybody that's joining us remotely is from, you will have a different name for it, but it is a federal program. And what this allows you to do, if you meet certain income requirements or perhaps other requirements, you could enroll your children in the federal CHIP program for health care, and that would be done on a sliding scale based on your income. If this is something you would want to investigate for yourself, or maybe you have family members, this is eligible for the general population as well. The website is listed and there's a phone number. This presentation is on your benefits website, so if you wanted to refer to this number or this website in the future, you can find it there, something you're eligible for. We're going to launch into the open enrollment. You all are in your open enrollment period annually. This is your opportunity to make elections for the next benefit year. It started on Tuesday the 28th, and you do have until June the 7th to make your choices. The choices you make will be enforced for the next year, from July 1st until next June 2020. The only exception to that would be if you have a life event between now and next July. That would be the typical things you might imagine, like getting married or having a baby, divorce, or even a significant change in a spouse's coverage. If that is the case, you may have a qualifying event. And with a qualifying event, you would have your own mini open enrollment within 30 days of that event to make some changes. But other than a qualifying life event, this will be your opportunity to make choices, and they will be in effect, like I said, for the next year. Now here's the good news. Operation Smile is offering you what I consider a very generous benefit package. I stand in front of a lot of employer groups, and I can tell you that it is a rarity any longer to have an employer, first of all, offer you a plan that's fully covered in premium, to give you an HRA contribution, and also to offer and pay for not only short-term disability, but long-term disability and basic life. A very generous and comprehensive package. Is going to continue to offer that to you. Now, the changes for this year are very few, but I will be reviewing them with you. The biggest one is that your medical carrier and your dental carrier is going to change on July 1st to United Healthcare. Currently it's Cigna, but it will be United Healthcare on July 1st. I think you'll find as we go through some of the benefits that in most cases, United Healthcare has mirrored to the best that they are able to your current benefits, and then in some instances there are some enhancements, and I will kind of highlight those as we go through them. You will still have your vision service plan benefit if you'd like to choose that. It is a more comprehensive vision benefit that provides glasses and contacts. Your life and disability benefits will not change. They will continue to be through Cigna. If you have a flexible spending account now through Beneflex, you do need to select in open enrollment your new amount for the next year that you'd like to contribute. And if you don't have a FSA or flexible spending account open now, you may want to consider doing that for the new year. And we'll talk about that a little bit as well. And then, of course, we have our legal and ID theft folks through Legal Resources. Alex and Danielle are here today. They're going to be available to answer any questions after the meeting, but there are no changes to those benefits, and it's a very good opportunity for you now to select that if you have not had those coverages in the past. So before I jump into the medical plans, I'm going to take a pause for a moment. Are there any questions about what I've reviewed so far, about the open enrollment, what we're going to be reviewing today? I see head nods. Okay, then I'm going to jump into it. So this might be a difficult matrix to see from where you are, but one thing I want you to know is that this same information is available not only in this presentation online, but the way that your benefits website has been created, you are able to pull up this matrix and then drill down into specific information on each of these plans, and I'll show you where to find that on the website when we get to that point. But here, just to highlight for you the plan offerings that you have. You do have 4 choices. 2 of the choices are HMO plans and 2 are PPO plans. Now, within those 2 plan structures, the HMO and the PPO, then you have an opportunity to choose an HMO that has an HRA with it, or a traditional HMO that does not have HRA dollars. So if I start from left to right in the columns that you have here, your first plan is your HMO HRA plan. Now, regardless of which plan you choose, each of these plans will cover preventive care fully, 100% covered. So that's your commonality on all of your plans. That's one of the ACA requirements. So you will know that your preventive care will be fully covered regardless of the plan you choose. But with this traditional HMO plan, starting at the top, you see your primary care office visits and your specialist and your urgent care are listed at having a co-insurance. Before those coverages come into play, you do need to meet a deductible. And that deductible that you'll see about the 4th row down is $2,500 for a single and for a family. But the great news is that you have a contribution through the HRA from Operation Smile to help offset some of those deductible expenses. So the HRA amount that you're going to be offered is $1,500 for a single and then $2,000 for a family. So that $2,500 or $5,000 deductible then will reduce for your out-of-pocket costs based on that HRA. And I will go through how the HRA is paid out. It's kind of on a co-share arrangement, and that'll be, as we go through the HRA plans in particular in a moment. Now, the rest of the benefits under this HMO HRA plan, the emergency care and, of course, the labs and x-rays also require you to meet the deductible, and then they're covered at 20%. Your pharmacy on all of your plans does not have a deductible, which is the great news. You will be able to get any of the prescriptions that you need at the copay level that drug is in the United Healthcare tier structure. This particular plan, and then all of the others, this is one of the changes this year, is we tried to make the benefits for pharmacy consistent, so you can have some opportunity to compare amongst the plans and have at least the knowledge that your prescription drug benefits will be covered similarly. So the copays under this HMO HRA plan will be $10, $35, and $60, $1, $2, and $3. It is a flat copay, and then that is what you would pay depending on the medication that you have. Okay. In all instances, you will have a max out-of-pocket, a ceiling that you will spend for your health care. In this particular plan, it has an in-network OOP, which is out-of-pocket max, of $4,500 for a single and $9 for a family. And how it works is, as you have deductible expenses, whatever you pay out of pocket adds up to that $4,500 max out of pocket. Once you satisfy the deductible, as you're paying 20%, it'll add up to that max out of pocket of $4,500. Your copays, same way with pharmacy, would add up. So you will have a ceiling of what you have to pay out of pocket, no matter which plan it is, but the amount will differ. So for this particular plan, it is a $4,500 single, $9,000 family. So that is that HMO option. Any questions so far? Yes?
They say 20% of the bill, and you pay 20%.
Okay, the question for those on Skype, I've been asked to repeat so they'll know, is who pays the 20%? Is it the member or is it United Healthcare as the plan? The 20% is your member coinsurance. So once the deductible is met, you as a member would be paying 20% of that claim. United Healthcare would pay 80%. And then again, your 20% would add up to your max out of pocket. Okay? All right. Anything else? Perfect. Okay, well then I'm going to talk about the traditional HMO plan. Now, United Healthcare has a very broad network. So whether you choose the HMO HRA plan or the traditional HMO plan, you're going to want to check to make sure all the physicians you're seeing are in the United Healthcare network. I would venture to say if they're in Cigna today, they would be in United because they did do a network comparison for us. But there could be individual differences, so I will show you also a little bit later where you can find the United Healthcare provider search. So the traditional HMO plan, in this case, you will have copay level benefits and no deductible. Very similar to your current plan, you have a primary care office visit of $20, and anything that is billed under that primary care office visit would be for that copay that you would pay, the $20. Similarly, you have the copay for specialists, the flat copay, and for urgent care, the $75 is a flat copay. There's not any deductible to pay, but what you do have are other flat copay level benefits. The emergency room is a $250 flat copay. If you should have an emergent need, then that would be your out-of-pocket cost. Now, there are some coinsurance benefits that would come into play under your what they consider your advanced diagnostics, any kind of outpatient surgery. You would have a 30% coinsurance. Now, you heard me talk about max out-of-pocket plan. In this particular plan, your max out-of-pocket is $3,000 for a single and $6,000 for a family. So as you're paying those copays, it adds up. If you should have a service where you're paying 30% coinsurance, your out-of-pocket will add up. Once you spend $3,000 for a single or $6,000 for a family, everything's fully covered. And that's the way the max out-of-pocket works. Anytime you satisfy a max out-of-pocket, everything after that is fully covered. So this plan for the traditional HMO does offer a maternity benefit where you are able to see your OB doctor for routine prenatal care, and it will be fully covered for that physician. Going into the hospital to have your baby or any other inpatient care in this traditional HMO plan has a flat $500 copay. So that is another benefit that does not have a deductible and does have a flat $500 copay. Okay? So that particular plan gives you some opportunity to sort of sit down and look at copays and add them up to see which plan will work for you. Now, a lot of what I've talked about under the HMO plans really also apply under the in-network benefits for the PPO plan. The two PPO plans, the differences there is that you have an opportunity, if you would choose to do so, to go out of network and still have some coverage. But the out-of-network benefit would have its own separate deductible and different coverage level. So we'll kind of talk through the third column, the PPO HRA, and then the traditional PPO is your last column. So if you're looking at your PPO HRA benefit, you'll find the very top benefits that are in network are very similar and pretty much mirror what you have under the HMO HRA. You would still have your deductible, the $2,500 single, the $5,000 family, and that HRA contribution from OpSmile would be the $1,500 to offset a single deductible, and $2,000 would offset the family deductible. The coinsurance comes into play after the deductible is met. So for the PPO HRA plan, once you satisfy your deductible, you see your benefits that are at 20%. And then in all instances, you have your max out of pocket. For this plan for in-network, you can see is $5,000 for a single and $10,000 for a family. Pharmacy, just as I mentioned in the very beginning, has no deductible. You will be able to get your pharmacy benefits at the copay tiers that are listed, the 10, 35, and 50. And that would be consistent with all the plans. Where this is different, this PPO plan is different, is you see at the bottom where you have an out-of-network deductible. The out-of-network deductible is a $4,000 single, and it's $8,000 for the family. And then you would be asked, if you go out-of-network, to pay 40% after that deductible is met. It has its own max out-of-pocket that you see there. And this is just an option. Some people want to know that they can go out-of-network if they choose to and are willing to pay a little bit extra for that, because you'll notice your premiums are higher for your PPO plans. So lastly, your traditional PPO. You do see, similarly to the HMO in-network, you have some flat copays. You have a deductible under this plan, though. You do have a $1,000, $3,000 deductible if you were to choose the PPO plan when you go in-network. And then the coinsurance levels after the deductible are 20% with the traditional PPO plan. Again, you have your pharmacy without a deductible, and in all instances, you have that ceiling, that max out-of-pocket. So for the traditional plan, you'll see the max out-of-pocket is $3,000 for a single and $6,000 for a family. So you're probably swimming in your mind now, what do I do? How do I choose a plan? My best recommendation for you is you and you know your family and your medical needs. Last year, if you looked over the last 12 months, how often did you go to a doctor? Are you taking some medications on a regular basis? Do you know you have an upcoming surgery of some sort or an inpatient admission if you're pregnant? If you look at each of these plans as their benefits and you were to sit down and try to see what your out-of-pocket costs would be, you can look at flat copay benefits and then do your math. You can do that on any of the pharmacies. You can do your math. Will I be paying a $10 copay for pharmacy or will I be paying a $50? And if you need to know how much a general cost of a service is for coinsurance, the United Healthcare has a cost calculator that I'll show you, and you could go out and just do an average for a particular surgery. It'll give you what your out-of-pocket cost or the cost would be, and then you can do your 20% or 30%. And it's just a gauge, just a way for you to sit down and say, what might it look like for me, pocket cost for whichever plan I choose. That will be probably your first level, obviously, because that will be what you'll be spending out of pocket. And then you're going to want to look at premiums. The premiums are a separate out-of-pocket cost, and for your plans, again, Operation Smile, unlike any other employer I stand in front of, is offering you a plan that costs you nothing for premium as an employee. So in the HMO HRA, for that plan, if you were to choose that plan, for a single, it is fully covered by Operation Smile. It would cost you nothing in premium. And then, of course, you can see what it might cost you for that HMO HRA plan, and I believe this is also in your brochure, for your family members if you wanted to choose that plan. The traditional HMO plan for a single would be the $42.50, and these are per pay period costs, and you have 24 pay periods. The PPO HRA, as you can see, is a $20 premium, and then you have a $40 premium for a single pay period if you were interested in the traditional PPO plan. So those are the two things to really kind of sit down and do a calculation. What would I pay out of pocket for the plan I select based on benefits? And then let me take a look at what my premium cost would be. And that will give you a sense for what might work for you. Sure.
So I just want to point out, make sure everybody knows that, can you go back?
Sure, you want me to go to?
Yeah. So when you're looking at these costs, even for the children, spouse, family, Operation Smile's picking up at least half that cost. So I just want to point that out because I think that that's a really good benefit. It's a good thing that when I sit down with Jim and Bill and talk about what the costs are and what increases we're getting, it's always a conversation. And I know going in there to talk with them, they're really looking at what's coming out of your paycheck and how can we protect our families and how can we make sure that it's affordable care so that you can protect your families and put them on the plan. So just kind of wanted to point that out quick because I think that it kind of gets lost in the, oh my God, I've got to pay $362 every paycheck for my family to have coverage. Well, Operation Smile's paying at least $700 of that. So just wanted to point that out.
Yes, thank you, Nancy. And that is, again, I do talk in front of a lot of groups. That is, again, a very generous contribution to premium for your families, in addition to you all having an opportunity to have a free plan or a low-cost plan as an employee. So I spent a lot of time on the medical plan simply because that's the biggest change that you're going to have going to United Healthcare and then a few of the tweaks of benefits. And we've talked about the costs. So I'm going to kind of transition into how the HRA works. Any quick questions you may have about the plans that I've gone over? Yes, ma'am.
The HMO, does that allow you to go to any provider, or is that only for PPO?
Okay, the question was, can you go to any provider under the HMO?
Not out of network, but
in network.
Right.
The network for United Healthcare is out on the website. So you're going to want to look at the HMO network and then the PPO network. They may be very similar if they're like most carriers. They have an extensive network, and if they're in the HMO, they are generally in the PPO for in-network. And so in that case, with the HMO, you would need to see a network provider to have benefits. With the exception of emergency care, which would be covered no matter where you go, with the HMO plans, you do need to be seeing your United Healthcare Network doctor to have coverage. Okay?
You don't have to select a primary doctor.
Right.
I think what you're getting to is, do you need a referral to go to a specialist? And they did away with referrals years ago. There are some specialists that will say, have you seen your primary care? But that's up to the doctors. And the other thing that you should know, when we looked at the United Healthcare, their network overall is, and Kathy gave us a nice analysis, is bigger than Cigna's. Mm-hmm. And there was about an 85% match of Cigna and United Healthcare. So United Healthcare had more doctors, and the overlap was about 85%. So you should be able to find that your doctor's in there.
And is this just for Virginia, or is it also like nationwide?
It's nationwide. Yep.
Yes, the question was, is it just for Virginia? And then we said, no, this is nationwide or globally. Well, I say globally, domestically.
Yeah, we have so many employees that work outside of Virginia now, we no longer even consider. Honestly, Optima came back to the table with a really good quote this year, but it wasn't an option for us because we want to take care of everyone across the U.S. and give them the same level of benefits that we have here. So.
Yep. And Nancy was really clear that with United Healthcare that when they did the network analysis, they didn't just look in Hampton Roads. They actually looked at where all of the employees live outside of Virginia, and that those matches that she talked about and the extensiveness of the network applies even outside of Virginia. Okay? So yes, so HMO or PPO in network coverage, you would need to be using their network providers. Okay. Anything else before I jump into the HRA? All right. Oh, yes.
What do they refer to this HMO plan as on the United Healthcare site?
Very good question, because I just was looking at that, and we probably should label it, and we can. The HMO network is called Choice, and then the PPO network is Choice Plus. And it is mentioned later in the slide about which network to ask for when you are out there searching, so thank you for bringing that up. And the question for those on Skype was, what is the name of the plan or the networks for these plans? The HMO is Choice, and the PPO is Choice Plus is the name of the networks in the United Healthcare world. All right. So how does the HRA work? I mentioned a few times that for the HRA HMO or the HRA PPO plan, you do have a $2,500 single or $5,000 family deductible. Operation Smile will be funding into an HRA $1,500 for a single and then $2,000 for a family. But it is provided to you in a co-share arrangement. So what this means is that as you begin to use services that would apply to the deductible, and pharmacy again is outside of that, and preventive is outside of that. But anything that's sickness or provider related would mean that you need to satisfy the deductible. What will happen is as the claim comes in, you will be asked to pay 20% of that cost of the service, and the HRA through Operation Smile will pay 80%. So it's a co-share. So I'll have an illustration in a moment about what it would look like in an example. So it is an 80% co-share and up to the HRA max. Easy slide, but it really just kind of illustrates kind of how it would work. And the example would be that you're going in for maybe somewhat of a significant, maybe a hospital stay or having a baby, and you know that you're going to pretty much satisfy your $2,500 single deductible. So when you're doing a co-share arrangement, the full $1,500 that Operation Smile is offering to you would be paid out for the first $1,875 of claims. Because the way the math works out is once $1,875 worth of claims have come through, Operation Smile would have funded $1,500 of that, and then you will have been paid along the way up to that $1,875 worth of claims, $375. So you've spent $375. The HRA through Operation Smile has given you $1,500. So then at that point, you need to bridge the rest of the deductible and you, in this example, because you have the $2,500 deductible, you would need to pay another $625 out of your pocket to fully satisfy. Are you with me so far? Okay. So in that circumstance, you will have spent $375 as your co-share. You would have $625 to get you to your deductible, and then depending on what benefits after that deductible come into play, you would be paying a co-insurance, your 20% co-insurance. All of this is going to add up to that max out-of-pocket I referred to earlier. So the $4,500 max out-of-pocket, everything would roll up to that. So in this example, for services that would fully satisfy the deductible, instead of you having to pay $4,500 out of pocket, you will have spent $3,000 because that HRA, that $1,500 that Operation Smile is funding for you, is going to pay for your claims. So essentially $3,000 out of your pocket, and then everything's fully covered after that because you will have met your max out of pocket. So this HRA example that I've given, whether it's for the HMO HRA, would be the same thing for the PPO HRA for in-network benefits. You know, you would get your $1,500. Right. So the way it will work with United Healthcare is very much like today with Cigna. When you go to a provider, first of all, on July 1st, present your new ID card. I see it happen a lot where your provider office keeps on file your Cigna information because that's what they had when they last saw you. Make sure they know you have United Healthcare. Show them your new card. So the provider will file United Healthcare, and then they will apply their network discount. So wait until the claim has been filed, and once you receive an explanation of benefits from United Healthcare, that amount that you owe should match what the provider tells you that you owe. If it is a deductible expense, then what United Healthcare will do is then look to see if you have any HRA dollars available. If you do, they will pay out of the HRA, the 80% out of the HRA, and you would be getting a final bill for what should be your 20% cost share for that deductible expense. So you will want to match, of course, your United Healthcare explanation of benefits to your provider bill, and then there's an opportunity for you to go online for United Healthcare to see if you have any HRA dollars left. That will be your way of knowing whether or not you owe the whole bill that the provider has given you, or whether it's only 20% cost share. Any questions on that for those of you who maybe aren't on the HRA now? Okay. Yes?
A question. You're on several few times you have surgery, various doctors involved. And a lot of times some of those are not in network. I can't say I want everybody in that surgical room to be in network.
Well, I know that there are regulations in some states now. I'm not sure about those outside of Virginia, and at least in Hampton Roads. The providers, when you go into the hospital, when you don't choose your anesthesiologist, you don't choose your pathologist, you don't choose those types of doctors, it is to be covered in network. And you should be having the same benefit level as if it was a participating doctor. Okay. So if you receive an explanation of benefits from United Healthcare, and if you were to look at what you get billed as a provider and they don't match, get with one of us and we can help to kind of research that for you.
Yeah, and I would say that, first off, the United Healthcare network is so large, you'd be hard-pressed to find our major hospitals are not in the network. But we have actually worked fighting the claim before.
Somebody's getting out of their car. Don't forget to take your keys out of the ignition.
I'm like, that's not a microphone, that was a horn. But we did have an instance come up and we had to fight it, and the insurance company paid it because we just went back and said, look, this
Total cost after discounts is $100 for that sick visit, and it could be $120, it could be $80, but it's just an idea of just what your out-of-pocket costs might be. And as you're going through all of this, is it a deductible expense? Do you have some HRA dollars? So it's kind of an example of doing the math we talked about earlier. And this was meant to be a very general kind of comparison between the traditional HMO and the HRA HMO. This kind of an idea of the best case scenario, and the best case scenario being that you probably don't need much care, if you will, because under the HMO HRA plan, or in network under the PPO HRA plan, That first $1,500 of expenses is going to be paid at an 80-20 co-share, and your 20% will just be a small amount if you're not using very many services. So while this shows a huge difference, I can tell you this is just simply kind of a best case scenario of a traditional HMO against the HRA HMO.
Yeah, and I think that the main reason I wanted to include this is because I know it's super comfortable for a lot of you to say, I'm going to the doctor, I know my copay is $25 or $50 or $75. Like that known entity is a little bit more comfortable. But the reality of the plan is that if you go with the HRA plan, if the visits, the reasonable charge is $100 and the cost share is 80-20, you're only paying $20. So I realize you kind of have to do the math of it to figure it out. But I know, and I'm not telling you which plan to go with, but I have a family of 5. All 3 kids are athletes. Grace has been at we have a standing appointment with physical therapy. But we, typically I end up reaching my out-of-pocket max, but the HRA, if I look at in a good year and I look at all these things, when you really start figuring it out. So just kind of do the math. Kim and I both are available. We can sit down with you and kind of go through some scenarios if you want. But especially if you're a reasonably healthy person and you just go to the doctor a couple times a year, I just don't want you paying for something you don't need.
Okay, thank you. All right, so this kind of is wrapping up the medical plan discussion, but preventive care, fully covered. Please take advantage of it. This is kind of my nurse soapbox. Go for your routine physicals. Go for your mammograms, ladies. For you men, if it's time for a colon cancer screening or PSA test, fully covered. Let your health plan work for you. Find out, make sure that you're doing as well as you feel that you are, and if not, the preventive care is a great way for a doctor to kind of get a baseline on you so that you can have a comparison year over year how you're doing. Okay, it's fully covered. All right, so an employee assistance program, or EAP, will be covered under United Healthcare. I think they call it Advocate for Me. I'll show you in a few moments, but it is out on your website. It does offer you an opportunity for individual counseling, or we've talked with Nancy. She thinks that there might be some need that we can talk about for any kind of group sessions that we can talk about through the year. So telehealth or telemed, whatever term you'd like to use, is available under United Healthcare. They use Amwell, and the way to probably access this benefit is to set up your profile when you're not sick, because it is a very good benefit. It doesn't have a deductible to come into play, and it will cost you a flat dollar amount if you have one of the plans with a deductible or your primary care office visit level. It'll be a kind of a remote opportunity for a board certified physician to take care of you either by way of a mobile app or a computer. You can either be talking to them or visually sharing with them, look at this rash, my child has a sore throat. There are basic low level or lower level type conditions that these telemed providers can treat you for, and in some instances prescribe medication. And the 2 examples where I've had coworkers that have used the Amwell that we have available, one is a UTI, urinary tract infection. We women know that some people are prone to that, and the only way to get treated is to get on an antibiotic. Rather than having to sit in an urgent care and wait to be seen around sick people and have to pay what it costs for an urgent care, you could go through your telemed provider and comfort of your home, get them to go ahead and prescribe you an antibiotic. And the other would be for an ear infection. One of our coworkers, same thing, had been ill for a few weeks. Things weren't clearing up. By virtue of talking to the provider, they were able to prescribe medication for her. Okay? So your myuhc.com is how you can access that information and set up a profile. All right. I mentioned earlier about the treatment cost resources, and if you're looking at one of the plans that so again, on the UHC.com website, And there is a link on your benefits website. You can go to their section on treatment cost calculator. You can do facilities, the hospital icon, or you can do for providers, and it'll give you a chance to get an estimate of cost based on your geographic area. All right, dental. So dental, the good news about dental is your benefits are no different than what you have today because United Healthcare matched your benefits that you have under Cigna, but it will be with United Healthcare and their provider network, which again is quite extensive. So you will continue to have a comprehensive dental benefit available, and again, a generous premium contribution where it costs you nothing as an employee to have dental coverage. So go for your routine exams. They're fully covered under the plan. That's your type 1, your diagnostic and preventive services. If you need anything like crowns or fillings or any of those types of services, your type 2 or fillings or basic periodontics, that would have that small dental deductible of $50 for single or $150 for family, same as today. And once you satisfy that dental deductible, you will have 90% coinsurance if you use the dental providers within the United Healthcare network, and then 80% after deductible if you go out of network. And your crowns, dentures, inlays, onlays, all those types of major restorative services in type 3, you have the deductible, and then you have 60% coinsurance or 50% coinsurance. And that is 60% is what United Healthcare dental pays, and you pay 40. And then, of course, 50-50 is an even split. Now, the dental, when they refer to an annual maximum, it's an amount that they will pay for you in benefits for dental. It's a different reference. So the $5,500, which, by the way, I have not seen one this large, which is incredible. You have $5,500 worth of dental benefit for your year of coverage from July to next June, and that's per family member. Orthodontia is also offered to children or adults, and it has its own separate benefit maximum of $2,500. So United Healthcare, similar to today, with your current dental plan, if you have orthodontia, they will pay $2,500 out of benefits for you, and you pay 50% of the cost as the claims come through for orthodontia. Yes.
And our brochure says 40-50 deductible.
And which is your cost. And I think what we're trying to get to, and I think we'll probably change this slide next year, is we probably should be consistent. In the medical, we were showing you what your coinsurance is on the medical. On dental, we're showing you what United's paying. So United's paying 60% and you're paying 40%. So in your brochure, if that's correct on their out-of-pocket cost? Yes. Okay. Yes, sir.
Transition to the new provider, what their new deductibles will be.
There are orthodontia transition plans that all dental carriers have in place because that's the type of benefit you use over a couple years. If you wouldn't mind, if you can see me afterwards and let me get your information, and then we will find out how to go ahead and get that transition plan in place for you. And then figure out, it's probably going to be with your provider, how far along you are in treatment and how they separate out how they bill for it. And then we can go through that separately. Yes, sir. I'm so sorry, you're right. The question was around orthodontia treatment, and if someone is currently in orthodontia care, how will that transition when United Healthcare comes into play? So what we talked about is that United Healthcare will have an orthodontia transition plan. If this applies to anybody who's joining us remotely, please get your information through to Nancy or the benefits team, and I will reach out to you and give you information on how to transition your orthodontia care. Thank you for the reminder. All right, and how to find your dentist. This is again on your United Healthcare website, and there will be links on your benefit website to get directly to that find a dentist and also to find a doctor under the medical side. This is kind of a screenshot of what it looks like when you get to the United Healthcare website. And then vision. So before
Let me just say real quickly, go back real
Sure.
quick if you wouldn't mind.
Sure.
When you're going here, obviously you are not in their system, you don't have a login. Skip all of that and go to the bottom. You can still go find the doctors or the dentist, but I know several people have been trying to log in. You don't need to log in to find the doctor. Just go down to the bottom. And when you go into the dentist, because I was looking one up for my son the other day, when you go in to the dentist, there are ones that say preferred, and for those we get better rates, and so that means your copay may be a little bit less. So if you don't know anyone and you're picking someone, go with one of those. If not, then just go wherever. You're still going to get a good benefit.
Thank you. And I just noticed too, someone asked earlier, what do they refer to their network in medical? In dental, the network is called the Nationals Option PPO 30. That is the United Healthcare nomenclature for your dental network. And thank you, Nancy. I didn't realize that there's a scroll at the bottom, kind of like a visit as a guest. Because once you are a United Healthcare member and when you do log on and make a profile, some of this information can be put on after log on. All right. So before I go into the rest of the benefits, any questions about dental other than what I've already been asked? Okay, thank you. Vision. Great news is no change in rates, no change in plans, and bless you. This is through Vision Service Plan, just like today. This would be kind of a buy-up vision plan for you. There is a basic vision eye exam included with the United Healthcare medical plan, but it does not include materials. Vision Service Plan, this would be something you would want to consider if you need glasses or contacts. And it, again, is really no change. Same plan, same rates. Flexible spending account. All right. Here's where earlier when we talked about, you know, your family history, you know how often you go to the doctors, you know if you have medications. With a flexible spending account, you can get savings for putting aside money for things you're going to spend on anyway. If you're going to be buying some prescriptions, and in the flexible spending account world, it also includes dental and vision. So if you know you need glasses, contacts, you know you're going to the dentist, you know you're going to have an out-of-pocket cost of some sort. Your medical plan, you know you're going to be paying out of pocket for prescriptions or whatever. If you have somewhat known expenses, my recommendation, if you haven't done it before, is put money aside in this. It allows you to put in up to $2,700. You want to know that you're spending that much to put that much in. You can roll over $500. So kind of the risk-free, if you will, is if you know you're going to have up to $500 worth of expenses, you can designate to put $500 aside in your paycheck. It'll be taken out over the course of the year, every 24 pay periods. But with the FSA and the flexible spending account, the amount that you pledge is available to you on July 1st. So even if you say, I'm going to put aside $500 over the course of the year, you will get a debit card for medical, dental, and vision, and that $500 or however much you designate is available to be spent on that debit card. The dependent care account is different. It is still a tax-free opportunity. If you have a child in daycare, or even if you have an adult that maybe you're tax dependent or you're helping to care for them and paying for adult care, the IRS allows you to put aside up to $5,000 a year tax-free. Now, in this case, it is not all available up front. As you start to put aside paycheck over paycheck, however much you've contributed to the dependent care, you can reimburse yourself. So think about it as an instant discount, whatever your tax bracket is, 15, 20, or 25%, 30, 35, instant savings. So if you've not done an FSA before, please consider it. I like saving money, and I'm sure you do too, and it's a great way to do that when you know you're spending money anyway. Yes, sir?
Can you use FSA money on the dentist?
Yes, absolutely. Yes.
Just the same plan as last year, the same company?
Yes, it is. It's through Beneflex.
Are the rules still the same?
Yes, the IRS governs the flexible spending account FSA rules. And so a lot of what they tell you about in providing any receipts, and this is what's really kind of interesting, Beneflex, but the entire FSA and IRS world, is if you are paying amounts that are kind of flat copays, that claim information is available, and the card will be able to be used, like at a pharmacy. Your card chip or your card is programmed to understand that's a pharmacy, you're paying at a pharmacy, you don't need to send in receipts. So sometimes you're asked for a receipt if you go for glasses or contacts or something, and there's a kind of an odd little amount. It's called substantiation. The IRS requires that that claim be substantiated to be a valid tax-free benefit, and it's not Beneflex, it is the IRS. So you can upload receipts, scan them in. There's just easy ways to do that if you're asked for the receipt.
Yeah, it's just that, you go to a doctor and you pay a copay, and I've learned that you need to ask for a hard receipt no matter where you go, because you're going to have to scan it, send it. Even if your credit card receipt says, Dr. Smith, you're still going to have to talk with the big receipt and send it in.
And it's an IRS rule. It's around the provider, the data service, and what they did for you. And those types of things only exist really on kind of an itemized bill, or if you were to go to UHC and pull down an explanation of benefits that has that information, just whatever has those key things they need. And it is an IRS rule. Yeah. I saw, anything else? Okay. I saw another hand. Yes.
Just a question. So I want to pay dependent care until March. Is it something I should sign up for now so it starts coming out my paycheck, or should I sign up when I have that payment status change?
That's a very good question, because you will not, the question was around two things. The first one was around the FSA, the flexible spending account, and providing receipts. It's an IRS rule, and you would need to be providing information to Beneflex to get your FSA. The second question is about dependent care account, where the actual money's not needed until March. So there will be a qualifying event for you, I assume, in March, and that will be your opportunity then to be able to choose to put money aside. But the IRS maximums are kind of on a calendar year. So this is more or less around the IRS saying you can put in up to $5,000 per year, and you can't reimburse yourself until, of course, you have the event, and then you can only reimburse for what you've put aside. So I don't know if you have advice about whether putting aside in advance is a good idea.
It's funny because I just wrote that question down for you because I was going to ask.
Yeah.
So if you don't have a dependent, can you go ahead and sign up July 1 so that your ultimate per pay period deduction is not as large? Because if you wait till March, you're paying the child care and you're getting a huge deduction
exactly.
out. So can you go ahead and start in July even if you don't have the dependent yet?
That's a good question, and we'll ask. Yeah, Beneflex is right across the hall from me, but that's a good one. I've not been asked that before, kind of like pre-funding, if you will. Pre-funding before you have an event, and I'll get that answer for you.
Yeah, so we need to, because I know IRS goes by a calendar year, so that would be a different calendar year. So we just need to figure it out.
So that's why I want to make sure I double check with our Beneflex team. Okay,
So
yes.
someone online is asking, does summer camp qualify as dependent care?
And that is another good question we're going to have to double check on. I know it has to do with the licensing of the provider that's providing the service. And when you say summer care, sometimes some of those are park and recreation type things. So if you could provide some information about that summer program, the online person asked, we can double check it for you.
I'm pretty sure it doesn't.
Yeah, okay.
But we'll Giannina, we'll get back to you.
Actually, I have a kid summer camp at YMCA, so I know YMCA is like a licensed
That's like childcare
provider.
Yeah.
But I didn't know if like summer camp would be kind of like outside of that childcare provider.
Right. So one of your coworkers just said that she knows her child goes to the YMCA for childcare and then has some other summer camp aspects to it, that the childcare piece of her YMCA is reimbursable under the dependent care, but we want to make sure that we understand what your child's summer camp program is, and then we can better answer your question on that.
Thank you.
This is each year, is that plan year or calendar year?
The IRS looks at it for calendar year, but as far as your payroll deductions, you're designating how to come out between now and next July. So usually we have not seen a change in the dependent care amount for 2020. In fact, there hadn't been any changes in the last 2 years for dependent. We did see, a $50 increase this calendar year for the medical FSA. So you're not going to over contribute. If anything, next year you maybe could put in, if they go up $50 or $100, you can increase.
Okay, so any questions on the FSA? So these next couple of benefits are the pieces that are paid for by Operation Smile. So you get basic life insurance. So each one of you has this policy. It's a $50,000 policy. And when you go through the process of enrolling online, you will need to update your beneficiary, make sure it's up to date. Don't want to give that money to some X that you still have listed there. Although most of you are too young to have X's. I don't know. The short-term disability is really underrated, I think. It's really one of the more important things because it covers your paycheck. So we have health insurance, dental insurance. This is paycheck insurance, basically. So if you had to be off work because you had a broken leg or something, then you would get paid 66 2/3 of your income each week, up to a max of $750 per week, and it would last for 13 weeks. So it just basically pays you when you're not able to work. Then it would roll into long-term disability, same idea here. This then converts to a monthly benefit rather than weekly. Who knows who set this up when, but that's how they work. So on the long-term disability, we'd get paid once a month, and it would be 60% of your monthly income. And since these benefits aren't taxed when you get them, it's really like getting pretty much your whole paycheck because you don't have that tax implication. So you do have to be out 90 days before this would be in effect. And, of course, that's the amount of time that you'd be on the short-term disability. So those are provided by OpSmile. The voluntary life insurance is something that you can buy in addition to the basic life insurance policy that's $50,000. So you can, since you guys have already been in the systems and already enrolled in some of these things, if you've already enrolled in voluntary life, you can increase your life insurance by $10,000 each year up to the guaranteed issue. So the guaranteed issue for you guys is $130,000. So when you're first eligible, you can get up to the 130, and then after that, if you let's say you take 20,000, then the next open enrollment you take 10, and the next open enrollment you take 10. So you get up to that 130, and you don't have to fill out any paperwork. If you don't take this benefit when you're first eligible at all, even taking that minimum of 20, then you have to fill out an evidence of insurability and you have to be underwritten. They look at your medical information. So if you ever have anybody, a new employee coming in, make sure you tell them to take at least that minimum on that voluntary life insurance so they know they have it in place. Because the bad thing about any type of insurance is you can't get it when you need it. You got to get it ahead of time. When the flood's coming in, they're not going to give you flood insurance. So if you buy it on yourself, which again, it's 10,000 increments up to 500,000 or 5 times your annual salary, then you can purchase it on your spouse and your dependent children as well. And again, the spouse is in increments of 5,000 and it would be up to 50% of the amount you have. And if you wanted more than the 130 or more than the 50, then you would fill out the evidence of insurability as well. Okay? Any questions on the life insurance? Oh, okay. And you'll have a beneficiary designation for this as well. So 2 separate ones. All right, so the legal plan. As I said, we do have Alex and Danielle. Got it. Thank you. In the back, if you have questions about this at the end. But I can't say enough good things about the legal plan. I'm not a bad person, but I have used the heck out of this. Speeding tickets, I have a little bit of a lead foot, as well as I had my will and trust drawn up. That itself is the price, worth the price of the cost of this. It's basically $9 a pay period, and then you get all of these things free. So advice, wills, estates, you refinancing or purchasing a house, if you're adopting a child, elder law, so if you have your parents that need some documents drawn up, they're not even on the plan, but you are on the plan for yourself and your family, that can be taken care of as well. And sometimes it's just a letter from these folks. You know, I think it was my son was in college and the landlord wanted to tell us that the floors were in pristine condition before he moved in. And so just a letter from the attorney, and that just went away. So it doesn't involve much of anything except for their little name up on the top of that, but it really comes in handy. And for $9 a pay period, you can't beat it. And then things that are not on the list I just went over, those additional things are still covered, but they're covered with a discount, 25% discount. So still there. The other piece that's offered by Legal Resources is identity theft protection. So you have 2 options. You can choose the Gold plan, which is they monitor 1 credit bureau, or you can choose the Platinum plan, which monitors all 3 credit bureaus. But basically, it's proactive monitoring of your credit. So if you join this plan, then you give them all the information about yourself and the credit you have, and they monitor it. I was actually, this has been a couple years ago now, but buying a new couch, and since it was like a 90-day same as cash thing, I signed up for it. And right there, while she's filling it out on the computer, my phone dings because it was legal research, identity theft, telling me that someone was checking on my credit. So it was pretty cool to see it in action, but they monitor everything, and the kind of key difference between this and some of the other plans is you actually have $1 million worth of insurance. So if something happens, if they don't catch it and something does happen, then there's that insurance behind it so that you can help pay for any things that were done in your name. So if somebody goes out and buys a house in your name, then you might need some help with that. But as I said, Alex is here to talk about that piece if you need some help. And this one is really inexpensive as well. So $598, excuse me, for the gold plan and $948 for the platinum plan. Pet insurance. This is totally on your own. It's on the website. You just click a link. You go in and say what kind of pet you have as well as how much coverage you want, and then it will tell you what it will cost. Really comes in handy. My little Yorkie had to have one of his eyes removed because of glaucoma, and instead of costing $6,000, it was like $1,200. So I can't say enough good about this either, but it's not for everyone, obviously. But it's totally your account. It's not something that's really through the group. It doesn't come out of your paycheck. Okay, so that's it for benefits. So we're moving medical and dental to United Healthcare. The plans are pretty much the same as they have been. We're going to get you the benefits and rates sent back out to you so you have the correct setup there. All of the other benefits are staying the same, and when you go through this online enrollment process, you'll see all of those. So just like in the past, you're going to go ahead and go into your Paylocity web portal and then put in the company ID as well as your username and password. And then you're going to click on, if you want to look at the benefits, everything we just talked about, then you're going to click over here on OpSmile Benefits Portal. So that's where all the benefit information is. If you just want to get right to it and take care of your enrollment, then you're going to click over here on Enterprise Web Benefits. If you click on the See My Benefits piece, you're going to go in here, put in, this is a generic username and password of Smile and Wide to get to the benefits section. You'll be brought in here. You'll see all the different benefits we just talked about on the sidebar, which when you click on them, they open lots of information, lots of access to the actual documents attached to each web page. And then if you're ready to enroll, then you just come back to the home page by clicking on the logo and then hit Enroll in Benefits. Here's where you do have to log in as yourself. So this is bSwift is the platform that you're currently on. And here we've reset the password, so it's going to be your first initial of your first name and then your last name. That's for your username. And then the password has been reset back to the last four of your Social Security number. And once you do that and log in, you'll be brought into the enrollment site. So here, it's just going to take you through to check on your personal information. Check on the people in your family, make sure they're in here so you can see what the cost to cover them will be. At the bottom of each page, you do have to click the little box that says I agree and then continue. And the first thing you'll be doing is to be signing off on the ACA compliance piece, just saying you understand that we went through some things here and there's some other documents posted on the website and you know where those are. And then it will take you through the benefits one by one. So here you see you have the medical plan. Anyone you put in the family will be shown across the top, and as you click on their buttons, you'll see the cost of the plans will change. So then once you're done, it will show you what that cost for that particular benefit will be, and you go through each process. So on voluntary life, it will show you what you already have, and then you can go up by the $10,000 or $5,000 if you want to. If it's over the 180 guaranteed issue, on the employee only, then it will say that that amount is going to be pending until you get the evidence of insurability done. But if it's under that, you'll just be good to go. The flex spending, here you're going to say how much you want to take out of your paycheck each time, and then it will show you what that's going to be annually. And of course, the max contribution, that's an old slide, but it's $2,700 this year you can set aside for the FSA account. And then everything on the side will turn green once you've done it, so you know that you're good to go. And you'll be asked to put in the beneficiaries. You can have up to 6 primary beneficiaries and 6 secondary beneficiaries. So that's up to you as to how many you put in, but obviously it has to equal 100%. And then once you're done, it will take you to a nice review page. We'll list out every single benefit, who in your family you're covering, and what your cost will be. And then it'll ask you to agree that you're finished and click continue or submit. And then you'll have that confirmation statement for you to either email to yourself or print out for your records. And you really can go in and out of the system. You could go through this right now, pick and choose everything you want, print out your notification, your confirmation statement, and then go in 70 more times in the next 2 weeks if you have nothing else to do and it intrigues you. But you do need to go in. Everyone needs to go in whether they're going to enroll in something or waive it, because we have to have that decision in the system. And then print out your confirmation statement for yourself. And the one other question that's in there is whether or not you want to speak to someone, and just let us know that. We'll get in touch with you. And here's our contact information. Again, it's on the left-hand side of the benefits website. So if you ever need to get in touch with us either now during open enrollment or another time during the year, be sure to get in touch when you need to. Nancy, you look like you have something to say. No? The brochure is accurate. So for all of you on the phone, on the Skype meeting, we will send those out to you so you have those pieces. Any questions, guys? I feel like I want to say break and see who can go and finish their enrollment really quickly. No, sorry. Yes, sir. Yes, they're actually on the website. So when you log in, they're right there on the front page. Yeah, you go to Town Benefits, put in Smile and Wide, and they'll be there. But I'm going to correct it.
So you need to, it's single, it works single sign-on. If you go through Paylocity and you click that Benefits Enterprise, it'll take you right to the page.
Right.
And then it'll be on there. But
Town
the
Benefits,
rates are right in the system. That's what we were just were double checking. And they're right on the brochure.
Right. And so I'm